Health psychology is a form of psychology that combines psychological knowledge with how mental states affect the body.
This form of psychology was founded by George Chester Stone and has led to a number of contributions to the healthcare system.
Health psychologist Dr. Lizzie Steed gives more insight into health psychology within the application of health.
My name's Dr. Liz Steed. I work as an academic at Queen Mary's University of London. I've been a health psychologist for about 20 years. I think increasingly we're moving towards a more biopsychosocial model of healthcare, and so naturally psychology is a key component of that, whether that's looking at sort of factors which drive behaviour or the mechanisms of change or how we evaluate behaviour and outcomes. Psychology plays a central role.
This in turn has had an impact on how we view healthcare in our communities, policies, and biological levels.
D.F. Marx, even before modern day society, humans have had an infatuation with the idea that the world consists of spirits. Thus, people began to believe that there was a connection between body, mind, and spirit. Shamans used these ideas in their healing practices in order to survive.
One of the main interests of these ancient healers was how the body reacts to our emotions, which served as a bias for health psychology.
According to Vincent et al., through health psychology, psychologists are now able to provide a more holistic approach to support their patients.
George Chester Stone graduated with his PhD in psychology from UC Berkeley, and from there he traveled and became a psychopharmaceutical researcher. In 1975, Dr. Stone established the nation's first department of health psychology and worked as an editor for a health psychology journal.
According to D.F. Marx, health psychology is a form of psychology that uses the understanding of psychology to aid in healthcare and fight against illnesses.
The term health psychology came into being in George Stone's book in 1979.
According to D.F. Marx, there are four main subcategories of health psychology that focuses on these different aspects of health. These include clinical, clinical health psychology, public health psychology, community health psychology, and critical health psychology.
Each subcategory has different theories, philosophy, values, context, target groups, objectives, orientations, research methodologies, and skill requirements.
Clinical health psychology is one of the four disciplines of health psychology. D.F. Marx explains how it encourages maintenance of health, treating illnesses, and improving health care systems and health policies.
Though they may sound similar, clinical health psychology and clinical psychology are different. Clinical psychology mainly focuses on understanding mental and behavioral health across many groups.
Public health psychology targets groups that are more prone to health problems, like in the school system. Its main goal is to improve the overall health of the said group.
Community health psychology primarily promotes health to a community, for example, families. The main difference is that community is less prone to health problems and fights for empowerment and social changes.
Health psychology, which analyzes how economics and power impact social issues, health, and healthcare globally.
The context of something as big as the government. Though the varying context can change from something as small as one person to the entire population.
According to Johnston, beginning in the year 1986, the European Health Psychology Society, also known as EHPS, held the first of many conferences that consisted of 60 foreign participants, and in 1989, more than 100 presentations were counted.
Conferences not only gave birth to 7 books, but also aided in the spread of an immense interest in health psychology in Europe for the past 12 years.
According to Krant, the emergence of health psychology united practitioners and researchers within subspecialties in the field of psychology. Health psychologists can use their scientific insight to give input on various challenges faced due to chronic diseases.
They can help create measurements, therapeutic techniques, and information on prevention. Everything they do helps create awareness for different diseases.
According to Marnie Johnston, health psychology can be used to help predict outcomes of treatments and even disease outcome. It can also be used to predict the response of an undesirable outcome along with how patient may react.
Health psychology can offer the why to the questions presented around health. It can also include why people get certain symptoms whilst others don't. It helps to explain why people react how they do to health situations and why they even listen to health experts.
Psychology's mission is to help increase knowledge of health literacy and coping with health diagnostics. But because of this increased knowledge, there has been a surplus of misinformation being spread due to people believing they understand the topic of health fully. To counteract this, it's the job of health psychologists and medical experts to put the misinformation to rest and provide trustworthy info.
To Savara et al., a study by Lichtenstein, Gates, and Berg in 1998 in which they used co-twin designs within a sample that consisted of more than 1,900 pairs of twins in order to test the effects of divorce on a person's physical health.
They found that divorce has a negative effect on a person's mortality, as people who go through a divorce often experience social loss, which can cause an increase in early mortality.
Okay, let's talk about what the major burdens of chronic illness are. Well, the first two should be pretty obvious. It's cardiovascular disease and diabetes. But what shocked me in terms of the research that I've been doing and the area that I specialize in is this profound thing called mental illness, specifically depression, anxiety, and post-traumatic stress disorder, which in fact is the third greatest burden on chronic illness in the world. And then if you look at the risk factors that contribute to the development of chronic illness, these are all the things. A lot of alcohol use, high blood sugar, physical inactivity, obesity, smoking, poor diet. Now, what is striking about this list? There's something really striking about it, at least me when I saw it for the first time. That most of these, if not all, are directly affected by, if not caused by, behavior and lifestyle changes. Which means that changes in behavior and lifestyle can actually exact profound impacts on one's overall health.
Dr. Gautam demonstrates that mental health does have an effect on the body since it has been considered one of the major chronic illnesses affecting us today. Thus, as Dr. Gautam states, that our behaviors can have an effect on our health.
Health psychology, though still being a younger discipline within the greater scale of psychology, highlights important information on health and healthcare.
Health psychology is forever evolving and growing. It doesn't rely on fixed ideas and formulas, allowing it to shift with times and follow the course of nature. Health psychology is a discipline that always has room to grow.